let's do trach care. Trach care, okay. So this fella right now has, Jean-Luc, has a trach in. Okay. Put some air in his cup. Right. So for trach care really involves cleaning the inner cannula, but also cleaning underneath this flange. And that's part of, and also changing the trach ties if they need to change. Okay. Can you see them please? Or your stuff way in the back there. Okay, so for trach cleaning, we need to make sure that we have all of our safety equipment available. And safety includes suction. It includes a bagger mask, and also a flex tube adapter with it as well. Safety equipment for a trach patient also includes extra tracheostomy tubes. They're usually in a bag right beside the patient's bed. One the same size as what you have in, one size smaller. And dilators. So trach dilators are in there as well. Okay, so these are in every box. So trach dilators, you guys have seen these before? Yes. Not for picking your nose. Okay. Okay. So if we were changing the trach or there was an emergency with this trach, you could put this into the stoma and then keep the stoma open. Okay. So that's why these are always beside every patient's bed as well. Okay, so you would check your safety equipment, make sure you've got everything available before you get started with any type of care with your trach condition. Okay, so we need suction. I've got a yonker here, but we also we could have one of these little darlings on here. And if he was on the ventilator, and this is closed suction, but it's for a trach patient. Okay, so much shorter. It's not gonna go down as far. Okay, it's just for trachs, and it works exactly the same way. Okay, but we're saying this patient's out on the floors, so he only needs to be suctioned on a as-needed basis. So we've got a little suction catheter here, a little baggie. I've got some booze. Trach dressing. I'm going to put this one on. I'm only going to use half because I'm cheap. Stick this in here for now. All right. So that's a fella who needs a dressing. Okay. We'll save this one for and there's your sterile field for if you're doing a trach change. Okay. Can you fill that with some normal saline, aka tap water? Wonderful. Thank you. Yeah, put it on my sterile field. No, it's not sterile. It's not sterile. Okay. So when they're on the floors, it's a clean procedure. Okay. Everything we're doing is really a clean procedure. Where it becomes sterile is when we are changing trach tubes. The trach tube we're putting in will remain sterile until it's in the patient. Okay, but everything else is really just kind of a clean procedure. So I have gloves on. Really careful. Many of them. So far, 3. Okay. So, our buddy here, he's got, I'm just going to find a different inner cannula. Where are your inner cannulas? Here's these. Ah, there we are. Ha. Okay. So, trachs are color coded. Okay, so you have to make sure you put the right inner cannula in your patient. Okay, if we took an orange one, it's a much smaller inner diameter. So if I put this one in this patient, he'd have a heck of a time breathing through it. Okay, it's like trying to breathe through a straw. Okay, so make sure that you are using the right color for the trach tube that you're putting in, okay, or the inner cannulas. That's another mistake a lot of students make on a lab practical. They put the wrong color in. Okay, so we've got our inner cannula. So inner cannula, I'm gonna have a quick look at this. I'm gonna just use some tweezers here as well. Okay, I've got an extra dressing. I've got some 2x2 gauze. Actually, I've got quite a bit here, but we'll only use one of them. And I've got some sterile applicators. Okay, got some normal saline. In a lab, it talks about peroxide. Okay, hydrogen peroxide. Hydrogen peroxide is used at some sites, but it's not used extensively. Hydrogen peroxide is really great at getting off really dried secretions, especially under that flange of the tracheostomy tube. But what ends up happening is if you don't wipe it off or take it off properly with normal saline, it will actually irritate the skin and it will cause more breakdown. Okay. So we tend not to use it. We'll just stick with the normal saline. Okay? Normal saline should be enough to keep it clean. Okay. All right, so that's what we're gonna get ready to go. So before I can decide how many swabs I'm gonna need or 2x2s or anything like that, I'm gonna have to listen to the patient first. Do they need to be suctioned before I start manipulating this? This movement of this trach is gonna cause them to cough. So I wanna make sure that their chest is clear before I start manipulating. Otherwise, we're gonna be coughing, and stuff's gonna be spewing all over the place. I have goggles on as well before I get going, okay? So I wanna listen to the chest. So if I hear something, I hear a little bit of secretions down there, I could try getting them to cough, especially if they're out on the floors and on the ward, they should be able to cough themselves. If not, I'll have to suction, okay?